Hello guys, today in this video I'll be discussing lips, basic anatomy, proportions, and age-related changes. This is an image of anatomy for lips. For sculptures, it's very relevant as an injector. We are essentially sculpting the lip shape using fillers. It's important to be aware of different three-dimensional shapes of the separate regions or subunits of the lips. The upper lip has three central bumps, and they can vary in size. In some patients, the central one is bigger and the two on either side are smaller. In some patients, the two just lateral to midline of the upper lip are larger and the central one is smaller. There are two large midline bumps that comprise roughly the central two-thirds of the lower lip. The lateral edges above the upper and lower lip are flatter than the midline portion, and the border of the upper lip tends to be a sharp edge. The facial artery supplies the superior and inferior labial arteries, which anastomoses to provide the dual blood supply to each lip. The arteries lie between the orbicularis oris and the oral mucosa. Using medical terminology, the three central bumps of the upper lip are called tubercles. The lower lip bump are also called tubercles. Note there is 3 in the upper lip and 2 in the lower lip. In most patients, the midline tubercle of the upper lip is not as prominent as 2 on either side of it. The border between the red lips and the surrounding upper and lower white lips referred to as the vermilion border. In youthful lips, this is a slightly prominent ridge that serves to frame the lips. The corners of the lips are referred to as the oral commissures. With age and volume loss, the commissures can start to spread out and become wider. The small depression that runs from the midline upper lip to the base of the nose is referred to as philtrum. This comes from the ancient Greek phrase for the love portion, because the Greeks found the philtrum to be sexually attractive region of the face. The curved border of the upper lip centrally is referred to as Cupid's bow. In addition to the anatomical subunits, there are also certain proportions that one must keep in mind when analyzing lips and planning for either an augmentation with filler or volume restoration with filler. Ratio in vertical height of the upper lip to the lower lip in a Caucasian female is thought to be ideally 1 to 1.6. This ratio of 1 to 1.6 is also known as phi. This ratio has been found throughout nature and is also clickable in analyzing facial beauty. Phi is also referred to as the golden ratio and is very interesting to study. It should be noted that in women of color, the ratio approaching 1 to 1 is also considered attractive. So patients' ethnicity and overall facial structure must be taken into account when planning the ideal height of the upper lip and relative proportion to the lower lip. This diagram also highlights that the width of the nose ideally should be the same distance as the width between the corners of the eye. This is also the width of the central two-thirds of the lower lip, which are the largest relative to the lateral one-third of the lower level. On evaluating your profile, what's considered more ideal is if the upper lip projects more interior than the lower lip. In this different patient, you can see that her lower lip actually projects more interior than her upper lip, and it's not quite as pleasing to the eye. With age, lips lose volume, shape, and definition. In addition, the commissures start to thin out and widen, and the commissures start to turn down. The skin of the upper lip also shows age. The dermis becomes thinner. This leads to the vertical lines that develop. Factors such as sun exposure and smoking accelerate the loss of collagen, the loss of elastin, and in development of these fine lines. Skincare products that boost the production of the collagen and elastin and thickens the dermis. Daily use of the sunscreen and avoidance of drinking from straws can really delay the onset of these lines, typically in patients from the 50s and 60s. I hope you found the video educational. Please make sure you like, comment, and share with your friends.